Welcome back to the front page. It's Wednesday, which means your eye on health with Dr. Sudip Bose from Medical Center Hospital. Docs, thanks so much for joining us today.
Thanks, Robert.
Always a good time. Now, today we're talking about kind of a frightening situation for new parents. What are we talking about?
We're talking about febrile seizures. So imagine this cute baby here, cooing, and then all of a sudden the legs start shaking, the arms start shaking, the whole body starts shaking, child clamps up, starts foaming at the mouth, and the eyes roll up. What would you think?
I would panic. That's very frightening.
Very, very frightening as a parent to see this. And understandably very frightening.
Right.
But I also want you guys to understand out there that it's not as scary as it looks. Seizures are actually fairly common when little babies have fevers. Wow. And in the end, a simple febrile seizure, the kids overcome it and they do quite fine. I mean, they don't have permanent brain damage, they don't have harm from it after, and many kids just react that way. We had a prior segment on fevers and how fevers are actually can be a good thing, and we talked about how it's our inner army fighting bad invaders, bad bacteria and bad viruses. And you can look on our Facebook page or sudipbose.com or any of those for prior episodes, any of our past segments. And we talked about how fevers were not that bad. So when you see a seizure like this, what I want you guys to do is realize that kids do this. They usually outgrow it by age 5, and it's more scary for the parents than it is dangerous for the child.
Right. But shouldn't you call someone, call the primary physician, the pediatrician or not, just to make sure it's not something else? I would like people not to get in a car accident being freaked out coming in. Right. If you're really scared, call 911. Okay. But what the workup will end up being for the child is basically the same as if the child had a fever and did not have a seizure. Right. So when those invaders, invade your body, the virus and the bacteria and your inner army is fighting, it's that inflammatory process that causes the seizure sometimes. So it's not the fever itself. So it's not the parent's fault that they didn't give a Motrin dose or Tylenol dose or didn't control the fevers. It's just going to happen. And it's going to happen, and it's actually pretty genetic too. Like if you see the baby who had a seizure, their parents probably had a seizure, their grandparents, and this baby's children will one day probably have seizures as a child that they'll outgrow at age 5 and will not have permanent brain damage or a seizure disorder later. There you go.
It's about a 3% chance, pretty similar to the rest of the population, that as an adult, the child will have seizures.
Right, okay, so really the things to remember here is not to panic. Not to panic. And just, you can get the baby checked out, but as far as panicking, it's pretty normal, like you said.
And then just know if it does happen, there's about a 40% chance it'll happen again before age 5. Okay. And then they're going to outgrow it.
Happen again.
And also, you don't need seizure medicines. You don't need antibiotics. Parents often think there's something worse going on. And it's not. It's just the way children react sometimes to fevers. And it's really scary to watch.
But we learn something new every time here on Wednesdays. All right, Doctor, thanks so much for joining us. Hopefully some parents out there next time will not panic and will know what's going on. Thanks so much, Doc. And if you have any questions at home you'd like answered here on the front page, go ahead and submit them to the email there at the bottom of your screen. We'll be right back.